Good morning, everybody. I feel so emotional because we have such an important day. We're going to talk about results, shared information about the ProCare project. I would like to give you some technical information or organizational information. This is a CEM accredited event, and we recognize the 7 credits. For this reason, I would like to ask you to sign the registry at the entrance and also sign at the exit so that you can get the materials, the CEM materials, and then the questionnaire. And please write your name and surname. The event takes place both in place. There are about 20 colleagues who are connected via Zoom, so they are connected remotely. The event will be partly in Italian, because the majority of you is Italian. So we decided to present all the speeches that are in Italian, while all the international speeches will be in English, but there is the simultaneous translation. We as speakers will try to speak slowly so that we can help the translator. So you'll have the receiver. Please do not keep it in your pocket or in your bag, because otherwise you may experience connection problems. So keep it in your hands. I would like to give you some safety measures, so please use masks, keep the distance, then there are emergency exits as well. As to today's agenda, we're going to have a coffee break from 11 to 11:30, which is organized by the university, and we're going to have it in front of Antonini Palace at the Tomar Cafe. Well, lunch will be from 12:45 to 2, and this is a free lunch, so you can go wherever you want. As to the certificates of attendance and the CEM credits, we will send them to you. And as to the certificates of attendance for the speakers, it's the University of Udine that will send them. During today's session, we will have some discussions as well. If you want to speak, please use the microphone. We will not give the microphone in the room, but please come here to the microphone, to the main microphone. I hope we're going to have a very fruitful day, full of speeches, of reports. We will exchange information. I think I have given all the required information. Wish you a very fruitful day and enjoy the session. Thank you very much. Thank you. Thank you very much, Lucia. I would like to open the scientific session of today. I would like to thank our Slovenian colleagues who are here with us today. We also have Spanish colleagues, Irish colleagues connected remotely. And I would like to ask whether there is the translation into English. Can you hear it? Yes, I can. And we decided to have the simultaneous translation so that everybody can feel involved, especially the people who are here in place, who are from Italy. We also have people connected remotely so that we can have an international exchange of point of view. So I am very glad that I can host this meeting at the University of Udine. Yesterday we had a very intense working session with all the partners. This is a project that started before the pandemic, and it had to face all the challenges of the pandemic. So we're very glad today that we can host the final meeting, because up to a few years ago, it was not possible to have a meeting in place. And there are some positive colleagues who are not here today. We had to manage this aspect as well. I would also like to thank my colleague, Mrs. Lucia Cadorin, who has managed the whole project in a very great way. She's an employee of the Cro of Aviano. And then I would like to thank Barbara Narduzzi and Sarah Scarsini, who have collaborated during the project, which is a 3-year project. We will talk about that later on. You know that this project was recognized as a good practice at national level. Maybe our international guests do not know it, so we asked our president, Mangiacavalli, to greet us all. So I would like to open the connection with her. So welcome, Mrs. President. The floor is yours. Thank you very much, Mrs. Palese. Good morning, everybody. I am so glad to be here today, and I would like to greet you and tell you that you did a very important job for all the Italian nursing sector. This project, as Mrs. Palese said before, started before the pandemic, back in 2018. So this is a very significant international project because reflecting on healthcare based on evidence is something that is mandatory in our country at the moment. And I would like to say that because these 2 years have taught us something, but these projects dates back to even before 2 years ago. We need to qualify the nursing profession within a scientific framework, which is not just an academic framework. It has to be strongly academic, but we need to go to the clinical practice as well. So it is important to have a combination between the academic component, the scientific component, and our colleagues who are committed in the clinical profession on a daily basis. Because a research per se is not really useful, but we need a research to make clinical practice and clinical healthcare more significant. This is something useful for Italy, for all of our country. We want our colleagues to make use of the scientific evidence researches. And we need our nurses to be able to make use of the evidences coming from research. This is a very crucial aspect. In Italy, we need to have researchers, we need to have colleagues, PhD researchers, and we also need to create a synergy between the federation, the orders. I know that there are some presidents of the regional associations. So we need to work together with the academic world. This is something essential. We need nurses to know where to find scientific evidences to improve clinical practice. We need to have scientific-based healthcare that is at the disposal of the nurses. And in this case, we can have vast horizons, no boundaries, and no weaknesses anymore. So this is a very important project, a very important work, and this is something fundamental. On one hand, to raise awareness among the academy world or researchers, and we are also investing in our researchers and in our professors by means of the ministry. We need to strengthen this structure. We need to work on the quality of education, not just on numbers. And also this project gives a meaning of how research can improve clinical practice. A research can bring nurses in the conditions not just of reflecting and choosing among different healthcare pathways, but they can also agree together with patients what kind of solutions there are, and that they can also discuss together with the scientific boards to implement the interprofession concept. Personally, I believe that the pathway that we need to cover is to get trained, to get educated. We need to work in an interconnected way. Professionalism can be a group of professions that sometimes are not connected one with the other. And I would like to give you an example. If we consider the latest regulations, the challenge of the national plan for recovery and resilience. And this is a challenge that involves lots of different aspects, such as hospitals, nurses, and so on. And we need to have shared pathways. We need to get integrated. We need to get connected. So the passage from multi-professionalism to interprofessionalism is this one. Me, as a nurse, I come with my knowledge, my scientific knowledge and know-how that has been validated and that has been constantly upgraded with a continuous training. And I put them at the disposal of a team where there are different members, there are other professionals and patients as well. So this is the challenge that we have ahead. So if we wanted to work in an interprofessional way, we need to have a solid base connected to our discipline, our knowledge, and we need to be strongly educated so that we can make use of researches and evidences. So I would like to congratulate with you for this amazing initiative, also for the pathway that you have covered. So thank you very much. I would like to thank you for your time. We wish you a very good day. And hopefully we will be able to talk about the outcome of this meeting, the results of this project. So thank you very much. Have a good day. And thank you for your speech and for your encouragement. Now, I would like to give the floor to the president of the province of Udine, Stefano Giglio, who is already connected. Mr. President, are you there? Yeah, good morning. Can you see me? Yeah. Good morning. Thank you very much for your kind invitation. I would like to greet you on behalf of the Order of the Nurses of Udine. And I would like to greet also our national president who talked before me. I am sorry I cannot be there with you today, but unfortunately I had another event, so I couldn't take part in this event. And I am very glad to support you on behalf of the Order of Nurses of Udine. And I would like to connect this session to another session that we have experienced together, which was about high-end nursing practices. We talked about that we talked about that during the National Congress for Nurses last July. We are very glad that we can go on along this pathway, and I am deeply convinced that by recognizing these good practices, we can get benefits as professionals, but also as citizens. Because at the end of the day, citizens are the main point of reference for all of us. I can see that there are lots of distinguished speakers. There is also our regional coordinator. And I know that this conference is full of very significant speakers. I do not want to take other time. I am so sorry I cannot be there with you, but I will follow the event remotely, and I wish you a very fruitful day and enjoy the session of today. Thank you very much, Mr. President. Your support is very precious for us. Now, I would like to give the floor to the coordinator of the presidents of the orders of the nurses of Friuli Venezia Giulia and president of the Order of Nurses of Pordenone. Thank you very much. Good morning, everybody. Welcome, everybody. Welcome to all of our international guests as well. I feel so emotional. It is so good to be back in place after so much time and see people coming from different countries in Europe gathering together to create a team, because this is what we need. We need to stay together to build up a team, and we can only do that by means of research, by means of collaborating. And these will allow our profession evolve. I mean, in these 2 years, we have stayed in an almost standby situation, but at the same time, we were highly recognized by citizens for the job that we do, and this is absolutely important. So I would like to greet you also on behalf of the other 2 orders that are not present today, and I'm talking about Trieste and Gorizia, and I would like to thank the organizers of this event. So this is the start, even if today is the arrival point of a pathway. At the same time, this is the start of another pathway for our profession. So we're very good when we work, when we carry out activities, or when we have to find solutions. I'm talking about the Italian component, but sometimes it is quite difficult to write down what we do and to disseminate it to the others. I am one of the founders of the EUSEM, which is the European Society for Emergency Nurses. And over the past years, I managed to talk to many other colleagues from other European countries, and on those occasions, I managed to grow a lot. It was important to exchange points of view and information. This is our final goal. We need to take advantage of the knowledge of the others. We need to pass our knowledge to the others so that we can give benefits to the citizens. And this applies to all the orders of nurses of Friuli Venezia Giulia and to our federation as well. And I believe that the results that we obtained are amazing. So together we have to go on. The orders are there. We will do our part. We will play our role. I'm sorry I cannot spend the whole day with you today because I also have to talk to another congress, which will start in 20 minutes. So I need to go away. But I wanted to be here today to say thank you. I would like to thank everybody. Thank you. And now I am pleased to give the floor to my friend and colleague, Sanela. Sanela is a friend. She's been a friend of mine for many years. She is the DIN of the first, second, and third cycle of Diesenice, which is a faculty that is not far away from our border, Tarvisio. You can easily reach it, and she's a friend of mine because we've been collaborating for many years. I've been invited plenty of times to her faculty, and I am very glad that she's here today. The strength of this small faculty is dual, and they have the first and second cycle, which means the nursing program, the nursing students, the graduate students, and the PhD students. And this faculty allowed us to be involved in the ProCare project. The floor is yours.
Dear guests, dear participants, dear lecturers, and dear partners, allow me to welcome you all to the closing conference of the ProCare project, which was aimed at raising the awareness of the importance of nursing research and increasing cooperation between faculties and hospitals. I believe that these goals were achieved thanks to you. Excellent partners, and thanks to great project coordination. We managed to strengthen nurses' capacity for research and successfully brought together faculties and hospitals. Some of us even introduced new approaches for empowering nurses to conduct research in the clinical setting. One such example is Journal Club, which will be introduced today. To ensure the right structure of the nursing staff is available on the job market, cooperation between the clinical environment and faculties who provide their graduates with the right competencies to perform their job, possibilities for future studies, and career development are of utmost importance. Today, nurses are increasingly filling strategic roles in decision-making, leading, and management. Moreover, many have advanced nursing competencies in the clinical environment, so it is important that they have the necessary support for research and evidence-based practice, and change knowledge will contribute to high-quality, safe patient care. The ability to apply research methods and evidence-based practice will significantly contribute to critical reflection and solving clinical and other care-related problems. Lately, the issue that has been at the forefront almost everywhere is nurse shortages. Inadequate nurse staffing is becoming a big healthcare issue, demanding policy changes and the level of the health system and the pledge that the nurses can play a more important role in the shaping health policies. Dear colleagues, by being here today, you are confirming your life mission, dedication, and commitment to personal and professional development. Finally, I would like to thank all project's partners, hospitals, faculties, research respondents, and authors for their active participation in today's conference. A big thank you to Italian partners to organizing this event. Thank you. And a special thank you to those who lead the project activities and my co-workers for making sure that the project can run smoothly. I hope that the expectation of all participants will be met and that they will be share their knowledge and experience with others. Last but not least, happy mingling and chatting. Thank you all.
I'm sorry, I need to press the button. Thank you very much, Sanila. Only once. I will manage. And now, my dear colleagues, all of you who are here today, my job now is to, I will stand up and go to the computer, but first to tell you, my job now is to present you the project, just briefly, through the work packages and through the main outputs that we reached, so that you, all of you who are here today, thank you, that you will be able, if you will need, if you will wish, to use what we have produced in these 3 years, 3.5 years actually, because the project was prolonged due to the corona situation. So give me like 1 second to find my PowerPoint.
Di Pesiak di adattare il computer e di presentare. Questa è una presentazione molto...
This is a very short presentation of the project, even though it is quite complex. Katia was a point of reference for us, and I would like to give the floor to her. She will present the project.
The title or the name of our project is shortened is ProCare, as for professional healthcare, and you can read the title Hospitals and Faculties Together for Prosperous and Scientific-Based Healthcare. So what we were trying to do, and I can say now today, after yesterday's internal meeting, project meeting, what we were trying to do, and we did it successfully, is to build the knowledge triangle, so connecting faculties and hospitals and students and nurses and research, and in the end of time, also the better outcomes for the patients. We have 8 distinguished partners. You can see them up here. We have 1, 2, 3, 4, 5 faculties, 5 higher education institutions, and 3 hospitals. So you maybe are asking yourself why there is no hospital from Ireland, since also the Ireland University of Limerick is the project partner. The project was designed in a way that hospitals from Ireland were not included in the project. Why? Because the Irish partners were in the project. Their main assignment was to kind of moderate, monitor, guide us, so the rest of the participating countries, Italy, Slovenia, and Spain, to guide us how to upgrade the nursing in Italy, Spain, and Slovenia. Why? Because Irish partners, they have a very well, perfectly, almost to say perfectly developed nursing system, healthcare system, and their input with their knowledge and their way of work and their experiences was like very, very precious. And this is why they had no hospital included, because the things that we need to do in Italy, Spain, and Slovenia, they already have it. So we've learned from them, especially when we had the project meeting in Ireland. We've learned from them how they operate, how they work, etc., etc. I will shortly touch everything in the following slides, but I promise I will not be too long. So these are a few facts that we're talking about Erasmus Plus project. It is the Knowledge Alliances type of the project. That means that we need to work with higher education institutions and enterprises. In our case, enterprises were the hospitals. As already mentioned, the project was prolonged for half of the year because of the COVID situation. And this is the main theme now, the Nursing Research Knowledge Alliance. Nursing Research Knowledge Alliance with higher education institutions is the red line of the project. You can see here a lot of things are written, but what is important is the red one. So you can see that there were two main aims of this project. Number one, to raise the profile of research in nursing. And number two, to strengthen the cooperation between higher education and hospitals. We decided to reach these two aims with 5 objectives. Okay, I will read them here, and then in further we will go a bit more deeply into these 5 objectives. Objective number 1 is to build infrastructure with research leadership that will support research, of course. Objective number 2 is to improve access to research training and support opportunity. What does that mean? So that, let's say, I don't know, a hospital builds, makes, creates a place like, I don't know, a library or access to database or anything like that to get the nurses access. Objective number 3, to identify research priorities in practice. What does that mean? That means that hospitals can identify issues that need to be addressed, so the practical issues, and these practical issues can be consulted with higher education institution. The research can be done, I don't know, the students at higher education institutions can write their thesis on this issue, on this problem, and then give back the information and the knowledge to the hospitals. So these are the research priorities. Number 4, to encourage interdisciplinary, multidisciplinary, and of course interagency research collaboration. And number 5, to raise the profile of research conducted by nurses to internal and external organizations. What does that mean? That means that the wish, the aim of the project is, because the project is still going on till the end of the month, that the wish, the aim of the project is to encourage nurses to research, to publish their research, to attend conferences, to talk about the research, to write about the research. This is what it means to raise the profile of research conducted by nurses. Okay. Here are listed some key challenges which were addressed by the project. You can access to this PowerPoint, and I will not read this. I will go through the, let's say, interesting themes at this moment for your ears. The project addressed 5 objectives through, we had 7 work packages, but let's say the content work packages were from 1 to 5. And we address these 5 objectives through 5 plus 3 work packages. I will explain that. Can come back. We will come back here because I will return. We will continue with the work packages. So 5 objectives addressed with work packages. Work package 1 is about identifying various aspects of the nursing work environment. So we can keep in mind the 5 objectives and now these work packages. In work package 1, we conducted 3 studies. The main output of work package 1 was the report. The report is written in English, and also the summaries are in language of every partner countries, so Italian, Slovene, Spanish. And you are able to reach, or you will be able to reach these summaries and these reports on the web page of the project when the project is finished. And in work package number 1, the main things in this joint report is the description of nursing work environment. What are the barriers? What are the facilitators for researching? How about competencies, etc., etc. Then we have work package 2. Work package 2 is about the knowledge triangle. Irish partners were the lead of this work package 2. In work package 2, I've mentioned that the Irish partners were sort of mentors to us. In work package 2, the main things that are useful, let's say, for hospitals and clinical environments is the guidance document on how to create a research group and how to create and provide the journal club in a hospital. So how to do these groups and how to do this journal club in a hospital that will be functional. This is the main output of work package 2. Work package 3 is about the learning materials. Spanish team, they lead the work package 3. In work package 3, we've created 5 topics, online modules, each topic awarded with 1 ECTS. And in these 5 topics, you have knowledge, information, how to do research, what is research, etc., etc. So, but this information is like, this is like applied nursing research. So it is not on scientific level, it is not, I don't know, for going for deeper understanding, but it is the basic information and trigger to do the research. Work package 4, Slovenian partners, Faculty of Organizational Science were the lead. In work package 4, what we did is what was created in work package 3, so the content for the modules, was in work package 4 put online. So very, very soon you will be able to see what we've created because work package 4 implemented the words into action, or how to say. Work package 5. Work package 5 has the assignment to evaluate. How well did we manage to do this program? Is it understandable? Is it not? Does it need some modifications? Why did I say from work package 1 to work package 5? Because further work packages, 6, 7, and 8, are of course work packages that are mandatory in every project. This is dissemination, project management, and quality assurance. Quality assurance is led by Italian partners, and each of these work packages, 6, 7, and 8, goes over entire project, and without these packages, the project cannot be done. It is not estimated well, it is not finished, because something always goes wrong if those 3 packages are not delivered as they should be. Now I need 2 more minutes just to skip back what we have. we stop here. So I took a little photo or a picture on the research. So here it says, you can read it. We need to use research to guide patient care. And she says, I do. And then she says, today I performed inductive quantitative research on pain, ta-ta-ta-ta-ta. And then the last picture says, in other words, you ask Donna what to do. So this is not research. Research is a bit more, and we will be all able to see this in our modules that we have developed. And just in the end, to say bye-bye, before I say bye-bye, here are our target groups. So the target groups to whom the project is dedicated. Nurses, registered nurses, nursing students, management, of course. We've also been researching the role of the management, healthcare professionals, patients, national, European levels. Our wish is that the project reaches all these 8 target groups. And I do hope, now I promise this, I do hope that you will see the chance to use the project results, and I do hope that the project team and the project will give to you something that you will be able to feel, to use, and that will encompass and support your development. Thank you very much.
Grazie alla collega.
Thank you so much, dear colleague. Before leaving the floor to the colleague who will be the first moderator of the first session together with me, I have 3 main reflections. First of all, we have heard about the reasons behind the presence of island for hospitals. It is important that countries acknowledge excellence and get help in their improvement path. Second aspect, second reflection, you've heard about the word alliance. People doing research have to look beyond the present. We have to involve communities, hospitals, universities. Third aspect, third reflection, for those of you who want to develop their profile in an academic context, you have seen and experienced the complexity of a research project. Work package means objectives, means leadership, means commitment. So you've heard about the integrations of several steps and the complexity for a project which was a 3-year project. And the last part was about the expectations and the hopes that we have for the future. Possibly we will have a better implementation and sustainability in the long term. So these 3 dimensions, these 3 reflections are a source for incredible learning. Thank you so much. Once again, let me give the floor to my colleague now.
Part of this conference where we will discuss on nursing developments in 4 European countries. And in this part, each partner will describe the contents of nursing in their country and some peculiar experiences where research competencies have been developed and the cooperation between hospitals and universities has been enhanced. The aim of this part is to highlight the differences and similarities between the 4 countries. Furthermore, this part is dedicated to the university work package leaders who will present a summary of the project activities and the results that they have led. So first, I again invite Katja to present work on first part of work package 1, nursing work environment.
Thank you. So it's me again. I don't know if my name is Katja, and I'm presenting now at this point with this work package 1. I'm presenting the results of the work package, or just briefly presenting what we have discovered during our researches. So actually, I'm presenting the report of work package 1, and all the authors are listed here. First, before I will let Matea here, I would like to, before I let Matea here, Matea will be there because she will say a few words about nursing, Slovenian nursing context. I would like to say that I will read this. So that in just a few sentences, I hope you don't mind. So that today nurses need to be, it says, this is also the aim of the project, that nurses need to be users and generators of evidence to underpin, to do their practice. So what this project did, and starting with work package 1, is to the project wished to support nurses to be better users and better generators of the evidence, evidence-based nursing, and to use this evidence in the everyday practice. How is it today? How is it the real situation? Matea will tell us how is in Slovenia, because I know that my colleagues will also explain with a few words how is in Ireland and in Italy. So Matea, please.
Okay, thank you. Just to show something about Slovenian nursing context, it's only 35% of the nursing staff in Slovenia has a bachelor degree in nursing. The others are nurse assistants, so the majority of them. And shortage of nursing staff is present since 2007, and it has declined since. So this shortage has increased in years, and in 2016 there were already 25% of nurses missing, and at this moment this number is still higher. So high levels of job demands, minimum decision authority that we have, and the lack of autonomy around applying nursing skills are likely to lead to out-migration, and this situation is only worsened by the COVID-19 pandemic in Slovenia as in other countries also. That is really a short summary.
Okay, thank you very much. Because we will not go in too deep, as far as we know, we had, as mentioned, a meeting yesterday, project partner meeting, and the situation is very similar everywhere. In Italy, in Slovenia, in Spain, Ireland has a bit different situation, but this is just for the taste. What we have now, starting from the project, is that the project addresses two main issues. One is the lack of research knowledge among nurses, and the second one is our poor connections between hospital and higher education institution. This is what addresses the project, and nursing work environment, which was addressed in work package 1, is an essential part of getting the research started in much higher percentage, and getting the connection between higher education institution and hospital. We can see here the word evidence-based practice. Evidence-based practice is something that is, the evidence show and the history shows that evidence-based practice or evidence-based nursing, if we say, is something that is urgently needed for nursing development, on one hand development of the nurses, and development, of course, safety of the patients. No, I'm not missing number 1. This is why the work package 1 addressed this issue: how to establish nursing work environment that will be supportive to do research in hospitals. In work package 1, 3 studies were conducted. One study was the study on competencies. This was a quantitative study. We used the questionnaire, which is based on the EFN matrix. This matrix, the questionnaire, targets the 4 categories of nurses. These are healthcare assistants, registered nurses, general nurses, specialist nurses, and advanced nurse practitioners. And those 4 categories were addressed with the questionnaire in the context of this study number 1 in work package 1. I have the results here. The method, the sample, what was included in Italy, 271 nurses were included in this study with this questionnaire. In Spain 207, and in Slovenia, 187. As already mentioned, Ireland did not cooperate in this study. We were researching the competencies. With this study, it was a study on nursing competencies. So, how often do they practice in their everyday work? Do they practice over their competencies? And this study also was questioning how do they self-evaluate the competency of their work. So are these 2 things compatible? Do they work the work that they were trained for? Or, oops, I'm sorry, that they were trained for. So the main question was, how is with the competencies? Do nurses oversize their competencies? Do they do in everyday work more as they are trained for? Do they do procedures that they are not trained for? This was the study. I will give you just the results, the brief results, not in details. Let me find them. Okay, here I have. So study number 1 revealed significant differences in the differences in the extent of practicing competencies between healthcare assistants and general care nurses. The general care nurses who self-evaluated their capability for practicing competencies higher also did perform those competencies more often on average. So the bottom line is that nurses, they practice things that they are not trained for. They do have experiences, they know how to do it, but they sometimes oversize their competencies. So they don't have the papers, they can do it, but they still do it because they have the experiences. This was a briefly study on that. More you can see in the report. Then we have study number 2, is a study on, it was a qualitative study on perceived research barriers. That the study, we did 2, or actually 3. We did consensus groups for every country, Slovenia, Italy, and Spain, Ireland again excluded. We did consensus groups. Also here I have some information about the sample. In these groups included were managers, key stakeholders, leaders, educational institutions, etc., etc. Italy had 7 participants, Spain 8, and also Slovenia 8. The discussion, the point of these discussions in consensus groups was to find which are the barriers in nursing work that prevent nurses from doing the research. where are the problems? Where the nurses see the barriers not to do the research? We found that the main barrier was lack of continuing professional development regarding the research. We found that nurses with higher positions do not promote research for those in lower positions. So nurses who are in lead positions, they sometimes have this research enthusiasm and knowledge for themselves. We found that nursing attitude and motivation is always positive towards new things. These are like the main findings of these consensus groups. We also made then one more consensus group with all the partners in Ireland and compared the data. The third research was a RN forecast study. Why only for Slovenia? Because the RN forecast study is the study that was done in, I think, 30 European countries. But Slovenia, you from Italy, Italian country, you have the study, you were included in the study. Slovenia not. Just a sentence or two, the RN forecast study is the study on, but you probably know, on the nursing work environment, how do nursing, what are the reasons for leaving the job, how is the satisfaction with the job, how is patient satisfaction with the treatment, etc., etc. This is all encompassed in this study. But in the context of work package 1, the RN forecast study was done only for Slovenia, and data available here are only data for the pilot study. And the same, if I read a few, just a few results. No, I don't have the result. I have it further. I will give you the results. So this we have. Here are the methods. We have done all this. We have talked about all this. And the RN forecast results for Slovenian study is that you can see work satisfaction, work environment, quality assessment. All of that is like in the pilot study was done for Slovenia, semi positive, more positive than negative. I will not give you the exact data because you can read them in the report. I would like to leave you with the discussion. I've prepared only this one, but I would like to leave you with the discussion on work package 1. So the nursing work environment, everything that we have touched in work package 1, competencies, barriers to research, the RN forecast study, everything is extremely important to set your work environment, to set it in a way to promote research. Because only if you promote researching and evidence-based practice or evidence-based nursing, only this is the way to lift the profession, to continue to build on professionalization of nursing. So that's all from my side. Thank you very much. If you will have any questions, I'm more than available. Thank you.
Thank you, Katja. Next is Christine Fitzgerald, that will be on remote.
Hi, good morning. I hope everybody can hear me okay.
Good morning. Yes, we can hear you. Welcome.
Great. First of all, thank you very much to our Italian colleagues for putting together today's conference.
Can you just give us a second because we cannot see you yet? Now we can see you. Okay.
Hi.
Hello.
Yeah, I was just saying thank you very much to our Italian colleagues for putting together today's conference. The Irish team are sorry that we can't be with you in person today, but I will speak to you now. I'll just share my screen with my slides and I'll talk to you about the University of Limerick team.
Christine, can I just ask you, can you speak slow for translator to be able to translate in Italian language? So,
No problem.
Thank you very much.
Okay. So I can't share my slides at the moment. It says that somebody else needs to stop sharing. So, oh great, you can see them perfect. Okay, so like I mentioned, my name is Christine Fitzgerald, and today I am representing the University of Limerick team who are working on the ProCare project. And our team consists of the project lead, Dr. Liz Kingston, and Professor Alice Coffey, and myself. Now, again, I can't.
Sorry, click on the slide, please.
Oh, perfect. Okay. Yeah, there I go. Okay, thank you. So this morning I will talk to you about the focus of our ProCare work package in light of the different context of the European countries in the nursing area, which Katja just spoke to earlier. So I'll briefly run through the Irish nursing landscape, talk a little bit about the Irish ProCare experience, and then look at the project activities that we have led. And hopefully these will be something that participants at today's conference can take away some ideas from and utilize in their own university or their hospitals to try and enhance collaboration between universities and hospitals. So briefly, just to talk about the Irish nursing landscape. So there has been a lot of changes in the Irish nursing landscape from the late 1990s. So this really stemmed from the Commission of Nursing Framework, which led to the development of roles such as advanced nurse practitioner, advanced midwife practitioner, and the nursing and midwifery practice development roles. And really what this started to initiate was a formal recognition in terms of the research focus that was seen from the Nursing and Midwifery Board here in Ireland. And this stipulates that both nursing and midwifery practice are based upon the best available research and experiential evidence. So with that kind of context in mind, I will talk a little bit about how this links to the work package that we're just starting to wrap up from the University of Limerick. So the focus of our work has been to identify the best ways to link higher education, research and hospitals to develop research capacity in clinical areas. Sorry, there we are. So in order to address this, we had our university partner, which I mentioned, involves the nursing and midwifery department at the University of Limerick. We looked at this focus then around how to develop guidance on developing nursing research and capacity through different methods, which I will talk through later. What these tried to explore were what were the main facilitators to collaborations between HEIs and hospitals, what were the main barriers between HEIs and hospitals, how do we overcome these, and also looking at pulling all of these together to inform the online learning materials, which the ProCare project was one of the main focuses of. And I know people are going to talk about that from the Spanish team later on, but some of our work would have informed the online learning materials, again, to use this as a platform to engage with nurses and universities to try and increase engagement with nursing research. Also, it's important that we recognise the contribution from our hospital partner. So the University of Limerick Hospital Group have been at the centre of our work package, and really, like Katja has mentioned earlier, they have really provided fantastic guidance in terms of really good approaches that they have been using in the hospital and to bring about increased research and engagement with nursing staff and university staff. And we're delighted that later on in the session, Jennifer Kahn from the hospital will be joining us to give us some really good insights into one of these approaches that we used in the ProCare project, and this was the Journal Club. So due to the establishment of the Journal Club in the Irish hospital in Limerick, We use this as an example of how to build collaboration and be shaped by the experiences of the Limerick Hospital. The journal clubs have been set up and facilitated across Italy, Spain and Slovenia. So it'll be lovely to hear a bit more about this from Jennifer Kahn later on. So like I mentioned, our focus was on identifying the best ways to link higher education, research and hospitals to develop research capacity in clinical areas. So how we did this was by engaging with 4 different groups. And of interest in this is that our group number 4, this is professors of clinical nursing, and this role was specific to the Irish context. So the first group was engaging with directors of nursing. Second was engaging with heads of departments from higher education institutions. And the third group was engaging with nurses involved in clinical practice. So we engaged with these 4 groups through a series of focus groups and also through some semi-structured interviews. And as a result of the engagement with these 4 groups, we were able to achieve the following key activities. So I'll look through these briefly, and I have some examples of these later on as well. So we used all of our discussions and collaborations from hearing with the different groups around what they thought was important in terms of their experiences with research collaborations, what they felt could be done more to harness these collaborations. And we used all of these engagements to develop different guidance documents. And the idea behind the guidance documents are that different hospitals and different universities internationally can use these guidance documents in a practical way to apply the recommendations that we have developed as part of the ProCare project, and to use these in their own settings to enhance collaborations and engagement in terms of research. So I will talk a little bit about those because they might be helpful to people listening this morning. So here we have some of these, and again, the ProCare project is coming to an end at the end of this month, and all of these documents will be available on our website for anybody who is interested to download and to use in their setting. And again, all of these are developed based on literature and based on interviews and focus groups that we have conducted across our sites in Ireland, Spain, Slovenia, and Italy. So just to talk about 3 of these, this first one here is looking at how do we set up a nursing research group. The second one, it talks at how to go about setting up a nursing journal club, which I spoke about earlier. We also looked at identifying research priorities. So this is a good kind of starting point for hospitals and universities that maybe are in the early process of establishing these collaborations. So through this, we linked in with the hospital staff and the university staff to see what really was important for them in terms of areas to research. And the idea around this was to collect a kind of database or a set of core areas that there is an interest in to conduct research in. And this is a really strong starting point to bring together interest from clinical and academic settings and to engage in specific pieces of research that are relevant both to the hospital and both to the university. And these can be added to and built upon to strengthen and enhance collaborations in a sustainable way. So again, these documents will be on our website, and we'd really encourage you to use these because they are very practical and insightful in terms of establishing and developing nursing research. And there's some more. So then our last final report, which will be published on the website also, pulls together all of these examples that I've spoken about and puts them all in one document. So this pulls together our research and our discussions that we've had across the different groups that I mentioned. And it uses the examples that the University of Limerick Hospital have been operationalizing over the last few years, and gives all of these examples in terms of case studies. And the idea is that hospitals and universities can use this report and guidance document, see where they are in terms of whether they're starting off the whole level of engagement in nursing research, whether they're a bit further down that journey, and they can take different ideas and apply them in their own context and setting to address and implement and enhance nursing research. So a really helpful practical document. And here, this is our kind of central model then from that report. And these are the different areas that are mentioned in our final report and that guidance document. So we will provide insight into the journal club, into setting up a research strategic group and the experience of the hospital in Limerick, the nursing research group, how to go about setting up a formal agreement between the hospital and HEI, then examples around engaging nurses in conference participation and dissemination. So the University of Limerick Hospital Group in Ireland have been running a conference for nursing research and innovation for the last several years, and it's a really excellent showcase of bringing together nurses from the academic clinical setting and showcasing their experience and just how much expertise and insights from a clinical setting and trying to disseminate this across the academic audience as well. So that's been a really popular and successful event that has been running in Limerick. And Manuel will be talking to us later about from the Spanish team's the educational materials that will be going on the online platform. So again, depending on where you're coming from, you might think certain elements of these might be easier to achieve depending on the resources and the investment available in the hospital. So an overview of all of these different approaches is provided, and you can apply whichever is most relevant to the setting and to the area of interest in your hospital or university. So thank you very much for listening to me this morning. Again, I'm sorry that we can't be with you in person, and thanks to the Italian partners for setting up this excellent conference. And again, thank you to all of our ProCare partners for their continued support in the programme.
Christine, thank you very much for this input. Thanks. It was really interesting, but because of our time, I would like to ask Manuel Lilo Crespo from University of Alicante, Spain, to present their part. It's also remote access. So, are you there? Manuel? Manuel?
Hello?
Can we hear?
Hello?
Yes, hello, we can hear you. Just a second so that
Hello?
you are able. Hello?
Hello. Hello, everyone from Spain, from Alicante. This is Manuel Lillo Crespo from the University of Alicante in Spain. It is such a pleasure to represent the Spanish team from the University of Alicante today and for the whole ProCare project. So my presentation in this final conference is about the development of the online resources that we have used in our course entitled or named as research, applied research in nursing or something like that. We're still deciding. So let me show you my presentation. Okay. Can you see it?
Not yet.
Okay.
I see the Zoom browser.
Can you see it now?
Yes.
No.
Okay, thank you.
No, we can't see it here. Oh, now we can, yes.
Yes.
Okay. Okay, so
Please in presentation mode.
Okay. Can you see it there?
We can see
No.
you just.
Okay.
No, we can see, but
Please,
not as a
can you-
presentation.
Yes, can you open it as a presentation?
It is open as a presentation now.
No, we don't see that.
Okay. Can you see it now? No?
Se
No.
magari la regia può aiutarlo.
No. Stop screen and share your second monitor.
Okay.
Ci dispiace per questi inconvenienti, ma sono attesi di fatto.
We're sorry if we have any technical issues. E adesso?
No, you don't share in Zoom.
The screen, yeah.
Okay.
As you did before, the same.
Yeah, I did. I'm projecting like a slide, so I can see the slide, and I'm moving also the slides here, but I don't know what's happening.
So, do we have the slides? We can show them, not?
No.
Okay, let me remove this and try it again.
Okay,
Sorry
thank
for
you.
the delay. Okay. So now you can see me, is that right?
Yes, we can see you, and we can see reflection of your PowerPoint in the back.
Through the mirror. Yeah.
Okay, this is what happens with technology. Okay, now I'm selecting my presentation again. I'm going to share. Let me know if you can see it now.
Okay, start.
Is it right now? Is it okay?
Yes, leave as it is. That's okay. Okay, okay. Leave as it is. No worries. Go ahead.
Yeah, but the thing is that what I'm seeing is my presentation in slides. So I don't know if I'm moving. Is it the first slide here?
Yes, we can see it.
Okay.
No worries.
Okay. Okay. Thank you very much for the feedback. So what I'm going to present today is the development of the online learning program on nursing research. So it was the topic of the work package 3. And I guess all the audience at this moment, they understand what a work package is. Sometimes we as part of their research teams and the partnerships in these type of projects, we refer to the work packages and we refer to the intellectual outputs, but let me briefly explain what this is. This is just like a topic that we are, or something that we are developing in one part of this project. So the work package 3 was about the development of these online learning materials. And we, the University of Alicante team, we were in charge, we were the lead partner, we were coordinating with the rest of partners this part of the project. So about the work package overview, let me say that this was one of the first implementation work packages or actions that we had in this ProCare project. So what we were reflecting about at this point in this work package is, what do nurses in practice need towards using the last evidences published into their day-to-day? So we were very conscious from the beginning that we were not creating the traditional or typical course or model on research in nursing. We were creating something for nurses who are in practice, and sometimes they do not want to get to know more about research theory.
Manuel, can I just tell you that we are still on the page 1? So on the
I'm moving my slides, sorry.
Yes.
Okay.
Now we can see the second slide. Work package overview.
Okay, so then I'm going to keep this part, because when I try to put it in slide mode, then it doesn't work for you.
It is better. Yes,
okay,
it
no
is
problem.
better like this.
Thank you. So what I was saying is that in this work package, what we were reflecting about is, what do the nurses in practice, maybe most of you there in the audience and most of the nurses in the world and in Europe, need towards using the last evidences published into their day-to-day. This is something that Katja has introduced and Christine has introduced as well from Work Package 1 and Work Package 2. So how can we build bridges between theory and practice? We don't want to create something that is the typical master degree or course or postgraduate or module on research in nursing. From a theoretical point of view, we want to create something that is really useful, that is useful for the nurses who are in practice, in everyday practice. So which are the barriers and enablers for nurses to approach applied research or research in practice? This is another key question that we have been reflecting about in the previous work packages as well. So with all these questions and all these reflections, we arrived to work package 3. Personally, I have to say that I thought it was going to be easier, but we had so many discussions about how we were going to put all the right content for the nurses in practice. Remember that most of the partner teams, we come from the academic field, and sometimes we were thinking, we had in mind sometimes the contents of the typical course or module of research in nursing or nursing research, but this is what we are trying to avoid from the beginning. So based on the work package 1 and the work package 2 results presented, as I said previously by Katja and Christine, the content of the learning program consisted of the knowledge on the identified missing research and evidence-based nursing knowledge, skills, competencies of registered nurses in hospitals. Remember, we are developing this for registered nurses in practice. So we've had, as I said, so many discussions. The contents, feedback were discussed at the Limerick Transnational Project meeting, Limerick in Ireland. It was the last face-to-face one. And then we had a transnational project meeting in Alicante as well. It was the online due to the COVID pandemic. And now you guys are there. I wish I could be there with you. So we were reflecting about the nursing competencies in all the countries. Are all partner countries nursing competencies the same? How are we going to be inclusive for all the context? Remember that we have some consensus in terms of education in Europe due to the Bologna reform, but we still have so many differences in terms of competencies applied to the practice in our different countries. So what are we referring to when it comes to nursing research? That was another question that we had in mind. And that's why I said we are still thinking of the name of the title of this type of course, because we don't want it to be like the typical nursing research course. So strategically, we are thinking of talking about like nursing research in practice or applied nursing research. And the proposal from the beginning was that the learning program should be flexible, inclusive for all the countries, for all the context, for all the nurses in practice in Europe and maybe in the world, and based on real cases related to their day-to-day practice. So it should reflect participants' daily experience in healthcare settings. That was very clear from the beginning. And this is one of the main key points of our discussions. Another point of these work package and the ProCare proposal was that the materials were designed in a very economic and efficient manner so that everyone can access, everyone can use it. Nowadays, the materials are being uploaded and available in ProCare website. And at this point, we are piloting, dry testing, and trying to evaluate how it works. The materials are user-friendly to users, as studies show that nurses and nursing students are reluctant to move from a traditional learning or teaching paradigm to web-based course delivery. So we were very clear that it should be something very flexible, as I said, inclusive, and very useful for the nurses who are in practice and who are not researchers, senior researchers, academics, but nurses in practice. And the materials offer benefits from the international education and the latest evidences published. That is one of the aims of global citizenship agenda. This is another key point of the contents of this course and one of the key points of this work package. And we started working on this in September 2019 after our meeting in Limerick. So as you can see, we've been reflecting and discussing on all these points like for 2 years or 2 years and a half. So here you can see, I'm sorry you cannot see it with slide mode, but here you can see the very basic, clear structure that we created, we developed after our discussions. So as we had to create like a 5 ECTS European credit transfer, maybe you are related to this, we had to develop like 5 topics. So each topic could have like 1 ECTS, and there you can see the first structure that we developed. So we had topic 1, which was like thinking for nurses, observing, questioning, identifying your topic, formulating your objectives, questions, or hypotheses. So that was like, in terms of time, it was 1 ECTS. And it was one of the partner teams, in this case, it was the Italian partner team, developing in terms of sources, contents, exercises, activities, and evaluations for this topic. Then we have the topic 2 in this course, which is exploring. And it is about reviewing, exploring, and searching background information and literature published. It means evidences, gray literature. So the time as well is 1 ECTS. And then it was the Italian colleagues working on the sources, contents, exercises, and evaluation. Then we move to the topic 3. And for the topic 3, it is planning and testing. So as the basic contents, we have designing your action, selecting methods, techniques and tools, keeping the ethical perspective and piloting or pre-implementing. And again, we have 1 ECTS for this. And it was the Slovenian colleagues working on this with the exercises, evaluation, source contents again. As well, the colleagues from Slovenia, they were working on topic 4, which is doing. So as you can see, this is like an algorithm or like a structure, very logical structure that we use in research. In doing, we are talking about implementing, collecting data, analyzing, and producing results or outcomes. We are touching all these points very briefly and from a very practical way inside all these topics, as you can see. And again, we have 1 ECTS at the time, and the Slovenian colleagues, they have been working on the exercises, evaluation, content, sources, and so on. And the last one, the topic 5, was developed by my team. It's about evaluating, and it is about communicating results and different types of evaluation. So it's again 1 ECTS. And we were working on the sources again, exercises and evaluation. As you can see, we try to keep it very logical and very easy for users, for nurses who are not professional researchers or senior researchers, not even early stage researchers or academics. So at this point today, some of the aims achieved are that we developed the module materials regarding all the topics that I have been showing. So we created education and training program, which is e-learning, so it's distance learning. Every nurse from their own hospitals, from their homes, wherever they are, they can use it. We utilize existing open access material and learning materials on research and evidence-based nursing from accredited master courses in partner higher education institutions from our institutions. So this is something that the academics, the different academic partner teams, we are used to this. But again, I think I want to stop here and say that at so many points of our discussions, we had to stop and think that our target, our audience is a nurse who is in practice. So trying to keep it very clear, very easy, not so theoretical, very practical. So we take cognitions of the European Credit Transfer and Accumulation System, the ECTS. I'm sure you are all related with this. So the total program is like 5 ECTS for a basic level, level 7 of nurses. We have 5 topics, as you could see, with 1 ECTS each topic. I can tell that it takes like 1 hour maybe to work on one of the topics, one of the different topics. So it's like 5 hours. But we have so many exercises, so many quizzes inside. It's very dynamic, really. We have prepared new learning resources from the recommendation Work Package 1 and Work Package 2, working on the barriers and enablers that were identified and detected by all the partners working with their own teams in their own countries. We have prepared learning materials addressing wider perspective, I mean international perspective and national specifics as well. We are also translating contents with subtitles. So in our ProCare project proposal, it was written that the core learning materials should be translated into the different languages, not only English, but we have Spanish, Italian, and Slovenian. So it's very nice because you can hear one of our colleagues' voice who is speaking very clearly in English, and everything is translated with subtitles in Spanish and Italian, because we are quite concerned about the situation of most of the nurses around the world. They cannot speak English. So that was a key point as well. I want to stop on this point, the idea of the 5 ECTS, because these days we've been reflecting about that, and from some of the partners from hospitals, clinicians in Spain and Slovenia, some of the nurses, they were suggesting not only to talk about ECTS. This is again something very academic, and most of the partners in this project, we come from the academic field, and it is very clear for us to work on the European credit transfer. But in terms of ours, we are translating this so that you guys can use it in different countries, in different parts of the world, see the equivalence in terms of ours, and try maybe to do some kind of transferability to the nursing associations, to the boards of nursing. We know that in some countries, like for instance in Slovenia, there is some type of scale with points for nurses to work in different areas. So I think it could be interesting to not only talk about ECTS, but also to talk about ours. So going ahead with the aims achieved, we have added improvements into the learning material based on the evaluations that we've been conducting recently. We're still evaluating this with some of our students that some of them are nurses in practice, some of them are some of the future nurses or master degree nurses, nurses who are taking the master degree now, and PhD students as well. So they are doing their feedback to us about the contents and about how it works, how dynamic it is. We have made the learning materials available in open educational resources. I want to stop here and say that the learning materials include specially selected open access materials, and it comes mainly, as I said, from the accredited master courses. So we, the academic partner teams, we were using at some point some of the information, some of the documentation, some of the resources that we have in our own universities. And the Work Package 3 materials are intended for either to use within the accredited research or evidence-based nurses courses, mostly for the academic area field, on postgraduate level in partner higher institutions, or in hospitals, or maybe by boards of nursing, nursing associations around the world as training within the continuing lifelong education, or what we call CPD, which is the continuing professional development. And just to finish, I want to say that some of the added values of this course that we've been designing and developing these years, and it is related with our vision from the beginning, is that the course give us a constant feedback from leading organization in terms of topics and issues coming from World Health Organization, European Commission, the ICN, the International Council of Nurses. We have an ongoing evaluation along the program, along the course. When you jump from one topic to another, and also inside every topic, it gives you feedback all the time. You have like quizzes, you have evaluation games inside. It's very nice. So it's very dynamic, it's very flexible, as I said, very inclusive for everyone. And we are approaching to real cases. We are connecting all the contents with real cases. We are giving some clues to the audience, to the students, to reflect on their day-to-day cases. The structure integrates basic contents about evidences extraction from literature review, from grey literature, evidences extraction from real practice, good practices, pre-implementations, pilotings, implementations into practice, evaluation and improvement, developing evidence-based documentation. So this is something that is included inside this contents structure that I was introducing. And we are including an interactive platform that our colleagues from the Maribor University will introduce in their presentation, which is about Work Package 4. So thank you very much. It's been a real pleasure to work in this ProCare project that we are about to end. And thank you very much for the chance to expose our work in this final conference in Udine in Italy. Thank you very much.
Thank you, Manuel, for your presentation. Now I'm giving word to my colleague.
Yes. So, possiamo continuare con Alenka.
We can continue with Alenka, our colleague, and we would like to ask her, together with Lucia, to be as short as possible. You have seen that the project has been presented in the academic area. Now we are in the platform area, and then we are going to talk about the quality assurance.
My name is Alenka Baja, and I will present this internet platform that we developed for learning online evidence-based nursing. Actually, what I would like to say in the introduction is that e-learning has recently become an inevitable part of higher education institutions, and we've realized during the recent circumstances that it can be also an efficient form of education. It also expands our employment possibilities. And what I need to say that also in the healthcare education, the research says that students are no longer so reluctant to this form of education because they get accustomed to it. On one hand, so we have students who are prepared to use online learning, and on the other hand, we also have these challenges for the educators to prepare quality materials for them. That's why we were faced with some challenges. First, we had to select the platform where we will be using this online learning system, and also we wanted to use high quality materials, which, as Manuel already presented, were developed during this project. We decided to use Moodle online learning platform, which is very flexible. It is open source, and a lot of students already know the platform. During the last years, it has also been widely recognized in all educational institutions. It also includes a web conferencing system, and it's very, very flexible. We have seen that several examples of Moodle being used in healthcare in different ways of blended learning, continued education, compliance training, and so on. So we figured out that this would also be suitable for our solution. As Manuel already presented, we have included 5 basic topics in our educational process, and we have used the H5P plugin to enable the interactivity of the content. This is H5P plugin enables you to use interactive book, include videos, questions, include different types of presentation, as you will hopefully later see. We also have a Moodle quiz to test our, not our, but students' knowledge. And then the student gains a specific certificate to confirm that he has been attended and successfully completed all the 5 quizzes. So this is the point where I would like to ask the technician to enable me to access the internet.
Yes, exit the presentation.
Okay, thank you. Okay, so now we will go live. I have some issues. Well, this is our platform. I will log in now. No, I was introduced yesterday where I find the @ sign on this keyboard. And inside here, where first of all, I have to change my language. This is quite simple to English, or otherwise I could also use Italian for the buttons. And I have some, the student will go directly to this page. And here we have this prototype version of our interactive learning content. It is structured in chapters, so let me introduce the first chapter, the interactive book on thinking. I start with reading, and now here I have this interactive book, first with video presentation, that I'm not sure that we will have voice. No, we don't, there is actually voice also included. No, okay. Never mind. So this presentation is followed by several interactive activities. As you can see here, I can access different definitions if I want to. I can also, in a while, test my knowledge if I know how to resolve some questions. Oh,
Based on what you've just learned, which of the following answers covers all the purposes of evidence-based, practice-related research in nursing?
So here I have an interactive questions. Well, I'm not in the field of nursing, so my answer will probably be wrong, yes, okay. Some more questions in the following slide and so on. So this is the interactive video. Then following this video for each topic, we also have some presentations which a student can then see individually. He or she can also use these cards to see what some sort of definitions mean. So here is the definition of a certain point, and also here some answers and so on. We also have exercises, so here we have exercise text, and then I can check my knowledge. I've learned this one by heart. This one is the correct one. Yeah, I managed. Okay, and this is all only for training. So we also have, the student has an option to go to the in-depth learning materials and to check these links. But these materials are mainly, outside materials are mainly in English and will probably also not be translated. And at the end of each topic, the student is able to see which references were used to develop this topic, so he or she can also gain additional information. Also, if we want to see the next topic, maybe just this one. Oh no, I've entered the quiz. For topic 2, for example, here we also have some additional resources. It also includes a video presentation with some questions inside. And what I would like to show you here are also the tutorials for different research sites that the student can enter and gain more knowledge. Now, for each of the topics, we presented or we developed some sort of a quiz. For example, this quiz on thinking. I need to go now for a preview because I've already done this quiz several times. Not that I know the content. So here a student has for each topic 10 questions. And here is time, 15 minutes for each of the quizzes. And the student has to gain 80% for successfully finishing the quiz. So when I'm finished, and these are mainly the questions that are connected, well, not mainly, but these are the questions connected to the topic that the student has just reviewed. And when the student is finished with this quiz, he gets, or he or she gets the result, finish attempt. So here, my answers are saved, and I will say submit all and finish. Okay, confirmation. Well, I didn't do very well, but yeah, it's okay for the first time. Yeah, okay, thank you. So after all these quizzes are finished, the student can access the certificate, which is issued on the last date of the successful completion of all 5 quizzes. So this is something we will still work on a little bit, but actually this is now the prototype. What we still need to do is that, okay, this is my presentation. Now I can skip this part, and here we did some piloting with the students, and they will be able to use this, or all of the students will be able, or also nurses, to use the platform in regular courses or in addition as additional form of education. We have realized that the students gave us a lot of positive feedback. They liked the way the teaching was meant to be. What we need to take care of is also now the user management, content updates, because we have a lot of outside sources, which will sometimes, the web page changes or some of the video presentation in YouTube are missing, so we will need to regularly update and see if all the external links also work in a year or 2. So this was my quick presentation of what we've developed. I hope you like it. If any of you would like to join it at the piloting phase, please contact your colleagues from the ProCare project, and we can give you access to the platform. But now, in this phase, only in English. Thank you very much.
Grazie molte ad Alenka.
Thank you so much, Alenka. We're a bit late, so this is why I asked Lucia to sum up the part about quality assurance, and then we will assess whether to have the discussion now or later on. The coffee break is in front of the this building for everybody, so I do not want to steal any time for the social part. Thank you so much. Please, Lucia, you have the floor. Okay, let me be brief if technology helps me. In the presentation mode? Okay, perfect. Thank you so much. Well, for sure, the path done and defined until now has summed up some phases. On behalf of the University of Udine, today we have led our work package on quality assurance specifically. Let me give you a brief introduction of context and scenery to give some inputs and information to our foreign colleagues about the development of competencies in the research domain, but also in the Italian context. For sure, the switch to professional work to academic work has brought to development of competencies in the research context, but especially it increased focus in the context of research as well as the use of better evidences in clinical research. At the national and international level, we discussed about the development of special and advanced skills in our context, in the legislative context, but also in the deontological context, in a better development of competencies in the domain of the research. The PhDs were established in 2006 in Italy. In the last years, we have witnessed an increase in terms of international scientific publications. Supporting and encouraging research means ameliorating patients' outcomes, as we already know, as well as creating innovation, quality, and opportunities for international cooperation and interdisciplinary collaborations. We have developed in the last year several collaborations between universities and hospitals, and the University of Udine is leading several projects of research. And as for the development of skills and competencies in the domain of research, the ProCare project was and will be a very important project. As for the assessment of quality, this is a process launched since the beginning of the ProCare project. It is a process that will go on up until the end of the project. The assessment of quality started immediately with the aim of ensuring not only the quality of the project, but most of all the assessment, both in terms of process, but also in terms of results. We have adopted two types of evaluations. The first evaluation was an internal evaluation through several means and instruments for measuring from a qualitative and quantitative point of view, as well as an external evaluation through the Academic Advisory Board, which will conduct external evaluation of the entire project, as well as another external evaluation through the offices of the National Erasmus Plus, which will monitor the project. We were involved in several activities. In 2020, we developed a plan for quality, the so-called quality assurance plan. We also implemented two quality evaluations and self-assessments for each WP. We use several questionnaires and instruments and tools for assessing quality, but also reflection tools about the experience during the various phases of the project, but also about the results. Next evaluation will be done next week. Based upon the evaluations, we drafted two reports. We will launch the evaluation for the latest report after the conference next week. In May, we will also have a final evaluation where we will have a summary of all the results of the various ongoing evaluations. As for participation, both in 2020 and 2021, we had the participation of those colleagues who were actively involved in 2020 in the first work package, and last year, 2021, in the second work package. We have started with an evaluation of expectations and most of all of the new learnings. The new learning at the beginning of the project, but also in 2021. What about the expectations? We had so many expectations, especially including general objectives dealing with the project, but also specific objectives linked to the various work packages. For sure, the chance to share and discuss through meetings, both online and offline, helped a lot. The communication among communities, but also sharing of experiences, so being within the project, being part of the project, participating actively. This is for the first part of the evaluation for 2020, but also for the evaluation related to 2021. As for satisfaction for 2020 for WP1, it was very good, and the scale used was from 1 to 6. 80% of respondents gave ratings of 5 to 6, so much satisfied or very much satisfied. Same thing for 2021 with a percentage of 85%. As for collaboration and communication, satisfaction was really high here as well. And especially there was a good collaboration, a good exchange through the use of all the technological tools available, thanks, let's say, to the pandemic. At the beginning, we had a risk assessment done. For sure, the pandemic was not forecasted in 2029. As for the part of the management, satisfaction and participation was very high. All the partners were very active. There were meetings every 3 months during this period via Zoom, very fruitful meetings. So every time we had to discuss about some issues or maybe face some emergencies, let's say emergency, we were able to solve all the problems quickly through these virtual meetings, but also through a continuous and ongoing exchange via email or some other tools that we used. As for the aspect of dissemination, we try to make use of all the possible channels through presentations at the national and international level, the presentation of the results, also preliminary results in the various phases of the project. We submitted some articles, some publishments. We used the site of university, newsletters, social networks, everything available for spreading and disseminating the results of the project. That's it. I've summed up everything. Thank you so much. Hopefully we are not that late, so hopefully we will have some time for discussion. Thank you. Thank you so much, Lucia. Thank you, Petra. You were mentioned in one of the slides. Petra was a very important resource for the success of this work package, but for the whole project, I would say. Let's give ourselves 4 minutes before moving, because we communicated our delay at the bar. So we have 4 minutes, let's say, left for having questions, comments, both here in presence or online. If there are some questions via Zoom.
Qualcuno debba chiudere deve ammutolire.
Okay, so this morning we introduced the academic part, the efforts and initiatives. After the break, we will have the implementations in hospitals, so this will be very interesting. I would be very happy to have some interactions now. So also from those who are not present today but online. So possibly can we see them all on the screen? We have managers from CRO, from BUR. Thank you so much for being here. Foreign colleagues, we would like to say hello to them. It's not possible to share the screen at the moment. So what about you here in the room? Any reactions, comments? Let's see. Maybe somebody's trying. Do we have any questions, doubts, or anything else? Let's see. Also, the foreign colleagues, of course, feel free to say something. I think that there's some weird silence there. Okay, so please, there's someone who wants to take the floor. There's a microphone so that our colleagues from abroad can follow the discussion. Please introduce yourself as well. Can you hear me? Yes. Monica Ronco, District of Tarcento. I'm a nurse. I have a question. A bit slowly for the translation. I have a question for those who manage the WP1 part. As for barriers, the barriers detected for nurses for research, first of all, could you give some details about the barriers? Because you mentioned them, so to better understand what are the limits, so as to understand if I can be part of that situation, if I can see myself in that situation. And then I didn't understand if that type of result was then compared with other universities, or if it is still in your university. Let's say if you only assessed your own problem, or if you had some comparison, some discussions with others. Thank you so much, Monica. Very specific question.
Katia, I think it's for you.
Yeah. Can you? Now you can hear me probably.
No. You don't need to press the button. Yes, no, stop.
Okay. Thank you for the question. I will search again because for the notes. And regarding the barriers, the study was conducted in all 3 countries. So in yours, in Italy, in Spain, and in Slovenia. And we have gathered the barriers, the one that I have mentioned before, were gathered barriers recognized in all 3 countries. But this is why I'm searching the paper, because there are certain barriers that are specific, let's say only for Slovenia, Italy, or Spain. And I will tell you what did he find for Spain. And you will tell me if you see yourself that it is possible for you to be in a situation like that. So what we have found is I'm looking for number 28. 27, 28. Okay, have everything. So the common barriers that were found, but for more detailed information, for more detailed data, they are already in the report, but the report will be published when the project will be end. So we cannot go into deep data because you will find them in the report and hopefully also in a journal paper, which is slowly appearing. The first thing regarding the barriers is, the 3 things that were seen in all 3 countries is that lack of nursing planning and time organization for nursing research. This is one barrier to do the research in all 3 countries. Then we have special barriers that was recognized mainly in Italy, is the English language. This is also the barrier for doing the research in clinical environment. Then also for Slovenia this was found, but not for Spain. Then for Italy and Slovenia was found the problem of technology and availability of libraries. So in hospitals, there are not enough computers that, I don't know, if you have, if you take, as a nurse, 1 hour of your time, let's say to cooperate, to be in a journal club, there's not enough computers to research, to find, I don't know, the research paper, the article, technology deficit. Then for Italy and Slovenia, again not Spain, we found that the barrier is also the nursing culture, because doing the research is not responsibility of the nurses. The nurses think that researching is not actually their responsibility, that it is the responsibility of the doctors, let's say. Yeah? And this is one thing that you, as a nurse, need to do the shift in your mind. So there can be nursing research. They exist nursing research. And of course, there is also a doctor research. But these are two identical but different fields. Okay? And what else?
Knowledge of statistics.
Knowledge of statistics. I didn't come back. Yeah.
A big problem is knowledge about methodology and statistics. And
yeah, this is the next one. Yeah.
They are quite don't want to start with research because of these problems with knowledge about that.
Yeah, it says here in all 3 countries, lack of education and training regarding research methodologies. Yeah. So the nurses are often scared. They don't want to touch any of this. I can continue. There are still a list, or no? Now you tell me. You tell me. What do you think? Did you, since you are a nurse, did you meet anything of this in your working environment?
Yes, some of them, yes. For example, okay, I mean, I think I lack time to do research.
Yeah.
This is the big problem because mainly, for example, at my department, my chiefs, my boss, they don't think that we need to research some time to do research because we have only to do the main jobs related to nurses. And this is the problem, that there is this lack of how to say?
You can say it in Italian.
Sì, c'è la difficoltà.
Yes, there's this difficulty to understand that also research is not only personal growth and growth for the whole department or the university, but also it is a growth for the patient, because the patient may be, well, this will be visible in a few months, it's not immediate, but we have this difficulty to have this future trajectory, to have a long-term thought. And so what I'm doing now, maybe the results of it will not be clear and visible now in the next 5 minutes or in the next morning. I'm not managing the patient now. I am doing that with a future projection. So thinking about the future, this difficulty of time reasoning, let's say, is blocking our bosses, our managers, so to say, to give us the chance to do something in these activities, because the utility, what we are doing, will not be visible in the short term. I think that there are also some limits for our colleagues in these activities, because the colleague who doesn't understand, because not everybody is geared towards this type of growth, maybe the colleague is not understanding what you're doing or why you would like to do it. And so that colleague maybe will put some brakes and then limit yourselves even more, because there isn't the support of the group. Because sharing is not only among international groups, sharing should be within your working group. And so there's the issue of barriers. This is the most difficult part to overcome, because this is the starting point. Once we overcome this, then we enter a virtuous path, and then we'll continue to go on. But we have to make this step first of all. Well, thank you so much. I would like to thank the colleague, because she entered the spirit of the conference, which is reflecting in a deep way, in a comparative way with others. Thank you so much for your beautiful question, because maybe some barriers, well, identifying them, we have done half of the job, let's say. Thank you so much, Monica. Now we have some time for our coffee, otherwise we will have no time for coffee. In Italy, coffee is important.
Le colleghe vi guidano.
Our colleagues will tell you where. Then we have Petra and maybe Stefania. They will come with you.
The coffee is for all. Please attend the coffee time.
Miss Pilar, do you hear me?